Hi, I'm Dr. Fiwad Mian. I own a practice called Neuro Wellness. Here at Neuro Wellness, we'd like to blend traditional and holistic approaches in terms of trying to make people feel better. We've had this practice now for the last 10 years, and I'm by trade a neurologist, but over time we've also developed an interest in predilection actually for treating patients with chronic pain complaints, as well as other issues that require some level of regenerative medicine. So what regenerative medicine is we're essentially trying to heal and help promote the growth of tissues that are chronically damaged. In our office, we have a couple of different treatments, and they're basically on one continuum. So you have prolotherapy, platelet-rich plasma, and stem cell therapy for that. With prolotherapy, we're using a sugar-based solution to help create an injury, which can help heal the injured ligament, tendon, or joint. There's also platelet-rich plasma, which works in a different way, where there are actually growth factors in the platelets that help heal the area that's damaged. And then there's stem cell therapy, which actually has the ability to differentiate into different types of cells, but at the same time is able to help heal things much in a more severe environment, including things such as joints and large tendon tears too as well. So for a lot of the folks that come in asking for these treatments, they're really trying to get out of having surgery. And in plenty of circumstances, there are those opportunities where we can actually treat those patients and prevent them from going to surgery or needing other different medications or drugs. In addition to this, we're also utilizing regenerative medicine for other areas that haven't been thought about too much over time. For instance, we'll also treat people who have loss of hair. So over the years, there's only been a few different options for people with hair problems. For some people, that may not be enough to try to help them grow their hair back. So we combine platelet-rich plasma along with other different types of topical treatments for the loss of hair. And more often than not, we'll also have to dig in a little bit deeper to see why you're losing the hair. Is it because there are issues with stress? Is your thyroid off? Are you anemic? Are there other conditions going on that are making you lose your hair? So we have to deep dive into that before even doing those kinds of treatments that I mentioned. But PRP and other topical treatments combined together can pay dividends in terms of getting your hair back. In addition to this, we also treat people who have sexual dysfunction too, particularly in men. Typically, there's only a couple of different treatments that are out there for it, and those are a lot of the medications that you see out there in the commercials. And unfortunately, what happens over time is that some of these medications may not work anymore. In our office, in our practice, we started utilizing platelet-rich plasma with a P-shot along with shockwave therapy to try to help patients who have issues with erectile dysfunction. And at times, they can also be combined with other different modalities of treatment, including the traditional medications that are out there, as well as such things as peptides too as well. In terms of the neurology that we do in our office, we see a wide variety of different conditions. So for instance, we'll see patients who have migraine headaches, and that's a commonly treated disorder. We'll see people who have memory problems, Alzheimer's disease, visual changes, memory loss, seizures, Parkinson's, multiple sclerosis. More common things tend to be things like dizziness, numbness, tingling, and various aches and pains in different parts of the body too as well. Now, for each of these different conditions, they may require different types of treatments, and sometimes we'll also blend in holistic treatments too as well to help complement some of the traditional therapies that we do in our office.